After each procedure, did you notice a difference, or
Not as
not
much.
as much as the
not
first
as
two?
much, just
Yeah,
the first two. But the first two, I think he did the deep vein,
majority.
and the bigger veins, right?
Yeah.
The latter ones were I had a lot of what do you call them, perforators, which were the small guys that he did, and they may not have had as much of a difference. I don't know, but I can tell you that he told me that some physicians don't do perforators. I don't know why, but I did have one on the end. I went in and I was impressed because I had my leg out. I had noticed on my right leg I had this little like bump on the inside of my right ankle that had come up after the last procedure. It looked kind of like just like a little egg, kind of, you know, but not real big, but just a little bump. But I thought, well, maybe it's swelling, you know, something like that. He walked in. He hadn't even stepped in the door, and he goes, "What's that?" I mean, he spotted it just instantly, and I said, "I know, I was going to ask you about that, you know." And I said, "I thought maybe it's swelling." He goes, "No, that doesn't look right." He goes, "I think you've got something," and one of them had reopened, and it was one little perforator. So they do make a difference, because that one little perforator, you could definitely see, and you can imagine if you had as many as I had, a combination of perforators, you could have quite a bit of blood down there, even, you know, even if they are small veins. If you've got a lot of them impacted, you could have quite a bit. But yeah, it was the whole, I wouldn't have anything bad to say about the procedure at all. Like I said, I saw on I think it was Good Morning America, they had a special where they had a girl on there they were interviewing that had it done. I think she had real bad varicose veins. I think was her original problem. But that was what she was commenting, was that she had so much more energy, she felt so much better. She had started exercising, which she said she had completely quit, and of course part of that was due to pain. But she said after it was over with, she was commenting about the energy. So I thought, I'm not the only one then that noticed that. But when Dr. Lee explained it to me, it does make sense. You know, it's anytime you get low on blood, you feel tired and sluggish, and so. And I have since met another woman that had, it's actually a woman I've known for many years, and I hadn't seen her in many years, and she has MS now too, and I didn't know that. And she was getting ready to have the same procedure, but she'd been passing out from it. And I told Dr. Lee, and he said, "Yeah, you can get, if you get enough blood down there, your blood supply, you will start fainting because you don't get enough blood to your brain, you know."
You were telling me that you were searching different MS sites, and
I follow those, you know, fairly closely, just out of interest and just to see what other symptoms patients are having. And of course, when I had this, I went online to see if I could see if other people had it. And in the very beginning, it was hard. I think I saw maybe one or two, and that was it. I didn't, you know, it was very hard. Now I'm seeing it more and more in the MS community, but still I have a feeling the word is not out there yet that, you know.
Is that one of your goals?
Yes, definitely. I mean, I would love to see more. Like I said, my neurologist said he had not heard about it, and I think, you know, there's probably a lot of doctors out there that probably are not aware yet that it's available, and as well as I'm sure most patients aren't, you know. So yeah, I would like to see a lot more, at least patients being checked for it if they're coming in complaining of pain in their legs, swelling in their legs, which is a very, very common symptom with people with MS. And it may be something else, you know, spasticity, nerve problems, but at least rule it out, so that, you know, they're being checked for it. And I would love to see that happen and have the awareness, you know, go up more for that, for the MS community. Because I have a feeling there's a lot more people out there like me and this friend of mine that.
Yeah, has this been life-changing for you?
Oh, definitely. And as I started to say in the beginning when I was talking about my history with MS, my legs have always been something I'm very concerned about, because that was where it hit me first, and where I was told, obviously, you're going to end up in a wheelchair. And so anything that threatens that, I take very seriously. And that was one of the things I told him that first day. I'll do whatever, you know, whatever, because I want to keep walking. I want to be able to keep doing as much as I can. And I feel like he gave me back something, you know, that potentially could have robbed me of that, and probably would have eventually. So yes, I mean it's definitely life-changing, and it's beneficial in other ways. You know, like I said, I feel better, they look better. There's a lot of other, you know, aesthetic things that are nice with it too. But most importantly to me, with what I live with is always having things work right, you know. It's nice that things look good, but first and foremost to me is that everything works and works like it should, and then after that, looks comes second. So, and that's just something I've kind of learned from living with a chronic disability,
If you could talk
disease.
to some of your comrades out there that have MS, what would you tell them?
Oh, well, if they live around here, I'd say go see Dr. Lee. And actually, I've already referred one. I do have one friend here in Dallas that has MS. I've known her for years and knew her in Hawaii, actually, but she lives over here. And I have told her and given her his info for referral. But first and foremost, yeah, I would say if you're having problems like that, get yourself to somebody like Dr. Lee. If you're not in the Dallas area, find one. But yeah, or fly here or whatever, but I would highly recommend him. And his credentials, too, amaze me, you know. I mean, the way up there, and he's got very, very good side manner, very easy to talk to. His staff, you saw me visiting in that, you come to get me in the lobby, and I'm visiting with the nurse that worked on my surgeries every time. I mean, they're just really down to earth and easy to talk to, and I know the office girls, you know, they always visit, and so yeah, I mean, it's just a very, very nice place to come and feel comfortable and, you know, feel like they care. I guess that's what I'm trying to say. Always as a patient, you want to feel like your physician cares.